So to conclude, some sources of inspiration. So this is something that I do at the end of every year. I am, of course, I love visualizations, and a lot of people and a lot of media also are publishing a list of what they consider to be their best or most interesting visualizations at the end of the year. And what I do is I collect these lists of visualizations and I put them in a list of data visualization lists. So I've done that since 2015. And so last year I collected the lists with the best visualization of 2020. And of course, Corona was all over these lists, so a lot of these visualization on these lists had to do in some way with the pandemic. And so you have people selecting their favorite visualizations. Like you can see here, it goes from visualization to data journalism. Also, we have here portfolios. So, for example, Reuters published a list of what they consider their most interesting visual stories. We have the New York Times, the Wall Street Journal. So many media are publishing these lists of their most interesting visual stories. I must admit that it is quite biased in the sense that it contains a lot of United States-based media, but there are some other examples here as well. And I wanted to pick one of these lists. It's by Flowing Data. Flowing Data is a website around data visualization that has been going for a lot of years now, and the man behind Flowing Data is Nathan Yao, and he also picks his favorite visualizations at the end of each year. So let me go through some of them to conclude this session. The first the first visualization Nathan mentions here is the flatten the curve. And I'm sure most of you will have seen this visualization. And also for me, this was eye-opening when I first saw it in February or March of last year. It really explains why it's important to take these measures like social distancing and wearing masks. It was all about flattening the curve, as it was called then, and I think it's a really impactful visualization and that made many people realize the importance of all these measures and why we should all follow these measures to not exceed the health capacity of the healthcare system. The second one, and I'm going to show this one, and this is by the Washington Post. It's a visual explanation of how a disease can spread in a population, and it turned out to be the most read article ever on the Washington Post. And it was also translated in many different languages, which I think is a very nice gesture of the Washington Post. Not only did they put this article in front of a paywall, but they also offered all these translations to explain this important topic to as many people as possible. So it's dated on March 13. So the first visual you see here is the number of cases in the United States. Of course, we all know this turned into something much worse than we can see here now. But the main part of the article is about these animations. It's all about a simulation of how a disease spread in a population. And in the introduction, it is explained that we start with these healthy persons. Each dot is a person, and the grayish blue dots are healthy persons, and the brown dots are sick persons. And when a sick person touches a healthy person, the healthy person also becomes sick. But after a while, these sick people also recover and they become healthy again, and they actually become immune, so they don't get reinfected. And then The main part of the article are these animations. So you start with a healthy population with one sick person. These people go around their business and they bump into each other. And when a sick person bumps into a healthy person, the healthy person gets infected and only recovers some time after that. And this little chart here shows you the proportion of sick people, healthy people, and recovered people. And it's resembling the flattening the curve visualization. So you can see that you have, yeah, at some point you can see the curve really taking off of the sick people. Um, then the story goes on, and here in this next simulation, they show you what it means to lock down a city completely. So what it means if you um, don't allow people to travel to other areas. Of course, then sick people are concentrated into a limited amount of space. But when you have a small opening, eventually the infection will cross over to the rest of the population. So it's a simulation of locking down a city, but it also shows you that it's very hard to really get control of a disease with locking down because it's very easy for diseases to slip through. You have some more here. Here they are simulating social distancing by letting a lot of these dots not move around. So you have a lot of people now staying in place, which means that you have a lot less contact between people. And you can see that this curve of sick people is now much lower, and it takes a lot more time for more people to get infected. And here it goes on even more. Here you have even less movement. And you can see when you have less movement, less contact between people, that the curve stays a lot lower than it would be when everyone would just go about and have contact with whoever they like. So a very visual story. It's not really interactive. You can only scroll and watch. But I think it explains the dynamics of a spread of a disease really well. And as I mentioned, this was the most read article on the Washington Post website ever. So really successful, and I also think quite impactful. One more about the use of masks by the New York Times. Of course, the New York Times has a team of around 40 people making visual stories, so they can make really impressive things. This story is about how masks work and how different types of masks work. Um, so it takes you on a journey with the virus, traveling through different kinds of masks. So you have a cotton mask and an N95 respirator, and the article goes on explaining how these different kinds of particles travel through the fibers of these masks. So it kind of takes you on a 3D trip. You can see the particles moving. And when the particles struck the fibers, sometimes they get caught, and other times they just travel along. And I think at some point we're going to switch from a cotton mask to an N95. So you can see different kind of fibers in different directions. And these fibers apparently also have an electric charge to them, which makes the particles stick a little bit better. So yeah, very visual and interactive way, also using the storytelling format to explain the differences between masks and how masks work. So also, yeah, interesting visual story there. Then this project, also by the New York Times, tells the story of how the virus got out of the city of Wuhan in China and spread to other cities in China and also to other countries in the world. Yeah, it's a story that contains a lot of data. So the New York Times got data, cell phone data, cell phone location data from millions of people. And so they combined it with numbers about infected people in different cities. And so they simulated how the virus got out of Wuhan. And it's very interesting. So they link it to the timing of the outbreak. Um, so you can see that when there were dozens of people in the hospital, well, research showed that yeah, the number of real cases was actually much higher. And if you continue, you will be able to see how the disease spread from Wuhan to other cities in China. It's not really working well with the recording, I'm afraid. So I'm going to let you explore this story on your own. Last thing I wanted to mention here before I close um, is the last one here, and it's actually a very important point, the honorable mention for the COVID-19 data behind the charts. And so Nathan here highlights the institutions that are driving or collecting all the COVID related data, because a lot of countries did not do a good job gathering and publishing all the numbers on cases and hospitalizations and deaths. And so other organizations stepped in. I showed you already our World in Data, but there are other institutions as well, like the COVID Tracking Project. I think this is for the US, and the Johns Hopkins Coronavirus Resource Center, which was a source for a lot of the visualizations that we saw. Um, and this is an important point, I think. Whenever you use data, you should be conscious about where it comes from, how it was collected, and what you can conclude from it. For example, in the beginning of the pandemic, the number of cases for each country probably had more to do with how countries were testing than with the actual level of the spread of the disease in each country. So whenever you use data, you should be conscious of how it was collected and what the source exactly is. Otherwise, you might come to the wrong conclusions. So I invite you also to check all the other lists on the list of data visualization lists. There are a lot of very interesting visualizations. As said, a lot have to do with COVID-19, but there are also others, of course. So make sure to check it out. And with that, I would like to conclude this session. You can find the slides that I used. There are only a limited amount of slides in the deck, but they contain the link to the SDG Atlas and the story that I talked about, and also the link to the list of the 2020 visualization lists on my website. So I wish you all the best in the literacy course. I think it's a very important topic, and I'm glad you all enrolled, and I hope you have been able to learn something from what I showed you. So thank you very much for your attention, and all the best.